So you were saying your appetite's a 10. How has your energy been?
We really care so much about who our patients are, and that is what drives us to come up with plans that help them manage having an MPN. I live with my husband and our daughter, who's the light of our lives, and our beloved, though crotchety, toy poodle. I like to do yoga. I am a very bad, but an eager knitter. I can do a pretty bumpy scarf. I am one of 7 siblings. My mom is a teacher. She's where I get a lot of my need for helping other people from. I'm a nurse practitioner specializing in the care of patients with myeloproliferative neoplasms on clinical trials at the Mount Sinai Hospital in New York. I like to think about nurse practitioners as sort of translators for the patients, but also helping the physicians navigate all of the different components of patient care plans. I've had patients say that just walking into the building that says Cancer Center in big bold letters makes them feel stressed. So when I come in, I know that that's where we're starting. And I feel like part of what we do to help bring comfort to that is to build these deep level connections and relationships with our patients.
We've had, you and I are at our 5-year anniversary.
The more we get to know our patients and understand who they are and what's going on for them outside of the scope of the exam room, the more likely we are to be able to address things in the right way.
How's your heart feeling?
We go over all the things that have been going on for them, any changes that they've had since they saw us last. We'll do a physical exam, and then we'll chat with our physician partners.
We also have to go over which patients have to be tissue banked.
Together, we'll come up with a plan for the patient, and we're the go-to phone call if something's not feeling right.
This morning,
I want to hear it all. That's the whole point. Who you are and what you're doing is why we're doing this at all. I want to know what you enjoyed about the dinner that you had, and tell me about your grandkids and why you love to garden. It's really that connection directly with patients that drove me to nursing in the first place. And the last time I checked, there were 55 open clinical trials for interventions for patients who have MPNs in the United States, which is remarkable. And I would love to see more options that help support patients in managing their symptoms and giving them more space to live their fullest lives. And of course, you know, I'm very lucky in that I think I have found my place and passion with the work that I do, knowing that I'm able to support people through a pretty tricky space of their life journey, trying to help support them the whole way around. Because this, for me, is really in my bones what I know I'm meant to do.